All right, everyone. Welcome. I am Dr. Sally. I'm going to be your host of the webinar tonight. I appreciate all of you coming out and spending some time with me, learning about what we do at Regenexx and how we can use interventional orthopedics to help with reducing pain and improving your general health. So in this webinar, I'm going to show you a couple different things. I'm going to go over our three-step process with you. I'm going to talk about where we get the cells. I'm going to talk about how they work. And I'm also going to talk, I'm going to tell you what they can help, what kind of conditions we can treat. And I'm going to answer some of the questions that you guys might have at the end. So if you want to type out any questions while we're going through this, feel free, and I'll address everything whenever we get done. So who am I? I'm Dr. Sally. I'm one of the newest members of the group at Regenexx Pittsburgh. I've been in practice with them since 2015. Before that, I did all of my schooling at Virginia Tech and the Virginia College of Osteopathic Medicine. I did my specialty training through UPMC in physical medicine and rehabilitation, and then did my fellowship in musculoskeletal sports and spine medicine in 2013. I'm an avid snowboarder and cyclist. These are my partners, Dr. Adelsheimer and Dr. Lieber. We work in the Pittsburgh area. We have several different offices around the Pittsburgh area. Most of the procedures that we do are actually based out of our Fox Chapel office in Pittsburgh, just north of the city. You can see in the picture myself, my partners, Dr. Mark Adelsheimer and Dr. Lieber. They have all been part of the Regenexx system since 2012. All told, we've done over 2,500 stem cell procedures, and we've performed over 10,000 PRP treatments over the years. So what we know about medicine in general is that there is a gap in the continuum of care. Usually it starts with, maybe somebody goes and visits with their primary care physician. They're prescribed maybe some pharmacologic interventions, maybe anti-inflammatory medications or some other form of nerve pain control or anything like that. They also may receive steroid injections early on in the care. After that, they'll do some additional treatment with maybe physical therapy or chiropractics, maybe some additional bracing during that time. And then it used to be that if all of those treatments failed, they would go directly to surgery. But we are trying to provide an intermediary between people failing more conservative treatments and then not going on to additional surgery. So we're trying to place ourselves in between that. So what we know is that the evidence base for orthopedic surgery is really actually pretty bad. If you look at the British, one of the medical journals for sports medicine, it shows that the evidence base for orthopedic procedures actually is unfavorable to other fields of medicine. Only about 53% of orthopedic surgeries performed in the United States have been shown to be ineffective in clinical trials. And that includes, even meniscus surgeries that have been going on for a long, long period of time that have really shown that in a randomized controlled trial that the surgery itself was actually not superior to a non-operative alternative or even a placebo in some cases. So do these surgeries work? Well, one thing that we can tell you is that the percentage of these surgeries performed per year is extremely high. So a lot of these procedures that are performed on people every year may not even be all that necessary and may not even be providing that much relief for people. Plus, surgery also increases your risk of things like heart attack, stroke, nerve damage, significant risk of increase for infection, blood clots, and even death. So instead, what we want to try to do is we want to try to use more, obviously less invasive procedures to help let the body heal itself. And what we're finding is that we don't think that surgical orthopedics will be the dominant form of care going into the 21st century. Like I said, with meniscus surgeries, 95% of the time, what surgeons are doing is they're actually just removing the meniscus spacer. Research shows that removing this meniscus tissue actually just speeds up the arthritis formation and the arthritis onset. So let's start cutting this stuff out, and instead let's use some of our own body's healing agents and biologic agents that can actually help for tissue repair and improving pain naturally. So Regenexx is a new form of intervention called interventional orthopedics. So with interventional orthopedics, what we're doing now is we're using less invasive new medical techniques and to provide a new medical specialty that mimics treatments that you would get for normal orthopedic issues like joint pain or back pain or whatever it may be. And we're using orthobiologics, which means cells that come from your own body, delivered by injections rather than being performed by surgeries or big cuts or staples or sutures or taking things out and putting new things in. It's a lower risk alternative to surgery, obviously. Within Regenexx, this is a highly selective physician network. So there's only about 65 physicians in the Regenexx network throughout the United States. We're using proprietary high dose protocols for our procedures, including PRP and stem cells. We're currently the world leader in research and development for stem cell procedures and all regenerative procedures as a whole. It's also a nationally self-funded employer practice. So it's not getting funding from other outside sources or other pharmacologic companies or anything else. Interventional orthopedics, to kind of better understand this, this is basically going from the knife to the needle. Just like with interventional cardiology, instead of now doing big open heart surgeries where they're cutting open the chest and separating ribs, they're actually doing a lot of heart procedures through a catheter that's inserted through the groin and approaching the heart through the actual blood vessels. This is a similar approach where we're just using needles and using these orthobiologic products to inject into the areas where tissue is damaged and where there's irritation happening and improving pain that way. Again, we're using your own platelets and your own bone marrow concentrate, and it can help reduce the need for elective surgical orthopedic procedures by up to 70%. So interventional orthopedics usually uses a lot of guided procedures, either by X-ray or ultrasound. And as the delivery methods and as the techniques with this continue to improve, we're thinking that most orthopedic surgeries will be replaced by these precise needle-based procedures. So our goal, again, is to use less invasive procedures to avoid more invasive surgeries. So this is kind of the typical setup of what a procedure room in the Regenexx network and even in our clinic looks like. You have the big C-shaped machine is the X-ray or the fluoroscope that we use for X-ray guided imaging for certain procedures. And to the right of that, you see the black colored machine. That's the ultrasound machine, which also helps with needle guidance and needle placement for more superficial structures. This is a picture of our processing lab where we actually address processing of the cells by hand in the office. So nothing leaves the office, nothing goes through any third-party processing or any other chemical processing. We do everything by hand in our own office space. So common conditions that we treat, pretty much what I usually tell people is we treat everything from the base of the skull all the way down to the tip of the toes. And as you can see, a lot of these different things that you're seeing on this list are pain issues and pathologies that you would normally be sent to an orthopedic surgeon to address. But all of these different things can be addressed with orthobiologic procedures and including PRP and stem cells. So with Regenexx, you're looking at less downtime. Most of the downtime from our procedures is usually only a few days. Shorter rehabilitation. So we end up, if we need rehabilitation, it's usually about a sixth of what you would normally go through for an orthopedic, following an orthopedic procedure. Fewer drugs where, people are getting off of anti-inflammatories and not needing as much pain medication after these procedures. You're back to work in a few days. You're not having to take off a few weeks or even a few months to recover from these procedures. And you're awake. We're not using a lot of heavy sedation to do these procedures where we're putting you under and having to intubate people and having to recover and all the risks that come along with that. So a lot less risk there. So what are some examples of interventional orthopedics? So currently what we're doing is a lot of work with injecting the ACL. So even people that have acute ACL tears, the ACL is a very important structural ligament in the knee. We can address this under X-ray because the ultrasound does not show the origin or certain insertions in there. But we do have approaches where we can inject and treat even acute ACL tears that are even complete tears. The precise guidance that we can utilize through the X-ray and through the ultrasound allows for injections of structures that would otherwise be very difficult and require surgery. Here we can see an injection on the right of injecting the top part of the shoulder labrum, which is kind of like the meniscus of the shoulder. This is a very common injury for people with arthritis or even young athletes that are throwing athletes. A lot of people will hear the word slap tear thrown around, and that's exactly what we're treating here is a slap lesion. So these approaches allow us to place these needles much more precisely and treat things that normally would require an arthroscopic procedure or opening the shoulder up to do. We can do injections both into the joint and into the surrounding bone of the joint. Sometimes injecting into the actual structure of the bone is more helpful for reducing pain that's coming from injury to the bone and from more advanced arthritic processes that are causing some bone breakdown. Recent studies that came out from some research just within the last year are showing that the 15-year outcomes with injections into the bone are actually very, very promising with over 80% sustained benefit. You can also see that we can use techniques to inject platelet-derived growth factors right around things like the median nerve. So for carpal tunnel pain, we can inject these platelet factors right around the nerve so that you can get relief directly at the site of the carpal tunnel impingement. And it helps with alleviating that nerve pain and helping people to do their work and improve their grip strength very well. This is a study from Regenexx out in Colorado that looked at recovery from a complete rotator cuff tear. In the picture on the left, you can see the large red arrow pointing to a complete tear in the upper part of the rotator cuff. You can see the joint fluid is that bright white signal that's kind of tracking out of the joint and up into the upper part of the shoulder. After the procedure and after the healing, about 5 months, you can see that the tendon is starting to heal and reconnect. You can see that that joint fluid is no longer tracking out of the joint and up over the shoulder because it's now contained in the joint following the complete healing of the tendon of the muscle. This is actually a young woman who was from Pittsburgh. She was treated for long-standing knee pain due to something called avascular necrosis. You can see the lesion tracking into her joint and causing a lot of pain after a year after her treatment. You can see on the right that lesion is starting to heal very well. And at that point, she was nearly pain-free. And you can see on the far right, she used to use crutches to get around all the time because she couldn't put weight on her leg. She did that for about 3 years and was then able to get off of her crutches completely after the surgery, or after the procedure, I should say. So how does regenerative medicine actually work? So when you're injecting things like PRP stands for platelet-rich plasma. So it's platelets that are concentrated from the blood from a blood draw. Platelets have growth factors that they contain that amplify healing and amplify cell repair and regrowth. You can think of PRP like an espresso shot for local repair cells. So it's kind of like the dictating conductor of what happens in that repair process. So this makes the cells that are actually doing the work harder and work longer. So that does affect how stem cells work. Stem cells are sort of like the general contractors for the repair job. They tell the other cells what to do, and they help to repair the damage. They also use those espresso shot growth factors from the platelets to help with that cell regeneration. And you can use those cells to turn into the bricks and mortar that actually replace tissue and actually heal tissue. And that's what helps with the actual recovery process. So which one is better for you? For smaller joints, especially in the hands and feet, and a lot of the joints in the spine, PRP works really, really well, even for more advanced arthritis. PRP also works in arthritis that is a little less severity, usually more that mild to moderate severity, but it also is very, very appropriate for ligament and tendon injuries and even long-standing tendonitis. And like I said, it works very, very well in the spine, in joints, and in around nerves. Bone marrow stem cells are actually used more for larger joints with more extensive damage or more areas where there's direct damage, large tears, or into the bone itself to help heal the bone, like I talked about. So usually we're looking at about 50% treatment with PRP and 50% treatment with stem cells and PRP. With the stem cells, you actually do get some PRPs with that. Significant cost difference between the two, and not everyone needs stem cells. So like I said, we'll talk about your different pathology whenever we see you in the clinic, and we'll kind of generate the treatment that we feel like would be necessary to treat you the best. So when you're talking about doing an actual stem cell procedure, what would you expect? So there's actually 3 different days that encompass a full stem cell procedure, and those days fall over the course of about a week. The first day is actually the pre-injection, or sort of like the preparatory work for the stem cells. And this is where we're more or less tilling the soil almost within the joint to plant the garden of the stem cells. We're actually using a mixture of sugar water to actually stimulate some very low-grade inflammation in the joint and around the joint to actually rally your body's immune response to the area. This actually creates an environment that is stimulating for the stem cells so that when they're introduced, they know what they're supposed to do when they get there. Usually people don't feel a lot of increased inflammation in the joint following these procedures, so it's not something that's uncomfortable for people. The heightened immune response prepares the site to take full advantage of those stem cells when they get there. So the first part of the second day is when we do the stem cell harvest. This usually happens a couple days after the initial injection. The source of the stem cells comes from the back side of the pelvic bone called the iliac crest. We concentrate the stem cells on site. We actually re-inject those stem cells back into the damaged tissue on the same day. And then after that, you go home. These procedures, this bone marrow stem cell draw is usually rated by people as about a 4 out of 10 on the pain scale. So it's not super uncomfortable for people, but we do accommodate a lot of that pain with superficial anesthetic and with some other types of anesthetic while we're actually doing the procedure. So most people tolerate this very, very well. The second part of that day is the stem cell re-injection. So like I said, this is where we're planting the seeds for the garden. And again, this comes about 2 or 4 days after the first injection. We do the bone marrow aspiration earlier that day, and then we go take those cells to the lab for processing, and then we usually do the re-injection later on in that day, and you'll go home again after this. The third day you come back is the PRP injection. So this is more like the fertilizer for the stem cells. This again happens about 2 or 4 days after the stem cell injections. We do a blood draw from the arm, very similarly to what you would do with a blood draw for your PRP's office. We take it to our in-house lab for processing, and then we re-inject it usually about an hour or 2 after. So when we're talking about research for these types of procedures, Regenexx actually has one of the largest bodies of research in the world of interventional orthopedics. We have the largest registry of patients that actually is currently being followed for outcomes related to stem cells and PRP procedures. That registry includes over 34,000 patients. And those patients are followed from time zero. It's not like these people are cherry picked from people that just have good results. This is people that when they come in for their procedures on the very first day, they're filling out paperwork and becoming a part of this registry. And we're tracking those results as time goes on after their procedure. There have been 29 peer-reviewed papers that have been published, which is a lot coming out of this conglomerate. There's ongoing research with different randomized controlled trials that are still going on in the works at Regenexx headquarters. And we use this as an outcome tool to actually figure out how to make these procedures better and how to make them work better for you. So with the world's largest safety paper, we actually, the result of this was to add existing body of evidence to show the safety of these mesenchymal stem cell based therapies for orthopedic conditions. So this safety paper showed that in over, I think it was 2,800 people, the biggest negative outcome with any of these procedures was really just pain at the injection site. It just showed that the risks of anything problematic with these procedures is exponentially low. And again, we use this to stack the deck in your favor. So we have the most highly qualified doctors using the most highly specialized and precise image guidance. We have the best quality research and safety measures on the market today. And it's concierge medicine. We're personalizing these treatments for you and your specific issues directly. So that's the purpose of the in-depth evaluation, is to really tailor a lot of these treatments directly to your problem and to what we want to see, and to your goals for what you want after the fact. And again, the evaluation and the candidacy, we make sure that when we're talking to you, we're being very clear about what we feel we can and can't do. And we want to be very transparent about that. And, we discuss differences in costs based on what we think we need to do and what's going to be the best. So who is Regenexx for? These procedures are really for a lot of different types of people who want to avoid surgery, people who want to keep all their parts, people that don't have time to take a lot of time off work or to be involved in lengthy rehabilitation, people that don't want medications or to be hooked on narcotic medications after procedures for increased pain, people that have had failed surgeries before, or maybe know somebody that has had a trouble after a surgery in the past, or in certain cases, people that are too young still for surgery or want to avoid that at a very young age. So results with the procedures, good outcomes. Overall, we're looking at less pain, improved function, improved mood, getting people off of pain medications and getting people back to preferred and active lifestyles. So for you, the next steps would be first, you don't need a referral to come in and to talk to us in the clinic. You have to just call. We'll set you up with an appointment. If you have prior imaging, whether that be MRIs or X-rays, gather them up and bring them in for us. We'll take a look at them. If we feel like we need new imaging, we can always order that. But if you have things that you've already had done, please feel free to bring that. Call the Regenexx liaison. I'll give you the number here in a little bit to get a hold of them. You come to the appointment and we do a thorough exam and we give you, whether we think you're a candidate and what we think you're a candidate for getting treatment. After we do the procedures, all of your rehab, if you've had it before, great, you can do some of the additional work at home, or if you haven't, we usually get you into some after the procedure and we help you get back to life faster. So step one, make an appointment. Like I said, we're all local doctors. I'm not sure where, some of you may be coming from a little bit of a distance, but everything, we're all very close to the Pittsburgh area. So, everybody's from here. We are specialized physicians, like I said, in physical medicine and rehabilitation. I myself, additionally, in sports and spine medicine. We have the additional training for the Regenexx procedures and implementing these procedures very effectively. And we have the imaging to actually help, or you can bring your imaging to actually help us to direct these procedures better. The exam, usually we're looking at about 45 minutes to an hour for the full exam. Usually I try to do some ultrasound evaluation actually at the procedure so that we know certain things that we're looking for on the surface and comparing that to some of the imaging that you may have had in the past. And we're also going to be able to answer a lot of the questions pertaining to your specific case. I know a lot of people have a lot of questions about their specific issues. It's a lot easier to get those questions answered once we know a little bit more about you and your actual examination to be able to figure that, to put all that in place. After the treatment, like I said, little to no involved rehabilitation after the fact, but we still do usually like people to attend some physical therapy to work on some muscle imbalances and strengthening. Minimal to no pain medicines after, minimal to no missed time from work or missed time from your day-to-day activities. Back to life sooner rather than later. So 4 reasons to take your health off hold today. You want to avoid the surgery backlog, and you want to avoid worsening of your condition. Some people feel like, well, I don't want to have surgery yet. I just have to learn to live with this pain. There's no reason that you need to do that. We have plenty of options to help get you out of pain fast today or very soon to be able to get you back to what you want to do. Getting back to fitness, getting back to weight loss, getting back to better activity. Obviously, that's going to improve quality of life, and it's going to just improve your general health for years to come. Increase quality time with loved ones. I talk to a lot of people that say they just want to be able to bend over and pick up their grandchildren or be able to play with their kids or just do the things that they want to do and spend time with their friends. That's what we're giving back to people. And in reality, no one is getting any younger. We're all continuing to advance in age, and we're all continuing to figure out new pathologies and new pains and new aches. And this is what we do. We help people to get rid of these things so that they're not held back with what they want to do. As far as financial information, insurance is going to cover usually consultations or follow-ups with us in the office. If we order any additional diagnostics, whether that's lab work or imaging or whatever it may be, and then bracing and physical therapy, that will all be covered by your insurance. What insurance usually does not cover is the regenerative procedures themselves, whether that's prolotherapy or platelets or stem cells. But with copays for a lot of commercial insurance plans, copays and deductibles may actually end up costing you as much as it normally would or it may actually cost you more for a traditional orthopedic surgery when you're looking at copays for surgery, hospitalization, post-treatment rehab, and how extensive that can be. Those costs add up very quickly. So that is something that you would need to take into account. And again, customized treatment plans. So there is a very wide range of pricing that comes with this. So it's normally easier for us to figure that out once we see you in the clinic and know exactly what we're going to be treating. So the next step for you, reach out and schedule a new patient exam. Sarah Furlan is our regenerative contact. You can reach her at 412-963-6480, and she'd be happy to set you up with an evaluation with us in the clinic, and we'd be happy to see you. So what I'm going to do now is I'm going to open the floor for some questions. I see that we already have some questions in the queue here. I'll turn on my video so that you guys can actually see me. Hey there. Let's see what we already have here. So the first question, where are the peer-reviewed studies to support the statement that Regenexx orthobiologics reduce the need for orthopedic elective surgeries by 70%? So if you go to our website and you look on the actual, if you look at the data from the registry, you'll see that over time and tracking these patients and looking at how people respond to these procedures as time goes on, you can see where elective surgeries have been undergone by patients. and where, usually that will taper out into the years. So that data is actually on our website, and you can find that either through our website or you can find that through the Regenexx proper website. Next question. I'm 63 years old with rheumatoid arthritis. I have arthritis of the hip. I already had the right hip replaced. While surgery was successful, I would like to consider Regenexx. Questions are, once your treatment is done, how often should I repeat the treatment? How long is it guaranteed to work before repeat? There's no magic. On knowing how long the treatments are going to last. So once the treatment's done, hopefully we would do the treatment and we wouldn't really need to repeat the treatment at all. That would be the goal. Or we would want to, repeat the treatment, want to take as long as possible to actually do that. There is no guarantee on anything that we do in terms of the treatment working or repeating. So, talking about your specific pathologies and knowing how your hip actually works and seeing you in the clinic and being able to talk through that. I think that would be something that we would have to do on a personal level to know sort of what we're dealing with and how we would have to approach that. Next question. I've been battling with chronic knee pain for previous 5 years. I've had many procedures and still not certain of diagnosis other than mild arthritis behind the patella, which is the kneecap. How do I know if there may be something going on that the MRI isn't identifying? When do I know if I'm a candidate for arthroscopy? I've been to your clinic and had SCP and not responding much of anything. Is it a thing to have pain sources unidentified? I feel like there's a lot of questions here that would normally be able to be better addressed if we could see in the clinic or talk one-on-one about these different issues. This seems to be a very personal kind of clinical thing. So, with treatments for knees, usually in the setting of mild arthritis, the PRP is usually very effective for those types of pain issues. If there is something going on that hasn't been diagnosed or something else that may be contributing to pain, then it would probably require a more in-depth examination and being able to kind of talk through that and seeing where some of the limitations are and what more we can do to actually give more benefit. Next question. If these procedures have been offered since 2012, why has the major insurance carrier not approved these procedures? That's a good question. We talk, I think every single person that comes into the clinic asks this question. When we're talking about major insurances, there's a lot of varying red tape that has to be cut with getting insurance companies to cover procedures. What I can tell you is anything that happens in the Regenexx procedures is approved and deemed appropriate by the FDA. Not approved by the FDA, I shouldn't say that. It falls under what the FDA deems appropriate for these specific types of procedures. So we're falling within all of the FDA guidelines in terms of cell processing and actually administrating or actually giving these procedures to people. When you talk about FDA approval and insurance coverage, insurances look at what they call level 1 type A randomized controlled placebo-based trials. The difficulty with that is that each and every individual has differences in sort of how we approach these procedures. So it's very difficult to compare not only the procedures themselves to something that isn't supposed to work, like just a single injection of saline, because that's like comparing elephants and pineapples. So there's not a very good study model that can compare the two things to be able to give the data that the insurance companies look at in terms of numbers to be able to say, okay, we're going to approve this. No matter how much data you put out about how many people will get benefit from this and how many people you help, the insurance companies still don't necessarily look at that. Although there have been very good papers that have been published recently on platelet-rich plasma treatments for the knees and for the hips and for shoulders that are showing much more superior results to your standard corticosteroid injections. So hopefully that data will drive more studies and will convince more insurance companies to cover this. How long that will take or when that will happen is next to impossible to actually say. So I guess that's the short answer for a much more complicated problem. But the next question, will a stem cell PRP procedure regrow any articular cartilage? Will either procedure assist in knee range of motion? So to answer the second part of that question, yes, when we do these procedures, usually it is helpful for range of motion. It depends on the pathology, but there are benefits that come with that. In terms of regrowing articular cartilage, if we're talking about regrowing cartilage in a very advanced degenerated joint, no, there is not regrowth of articular cartilage in that scenario. When we're not talking about regrowing a 25-year-old knee. That's I would be remiss to tell you that that's how these procedures work. It's a lot more of an involved process in terms of the biochemical healing of the joint from the actual joint fluid and how that affects bone structure and how that affects pain. But in terms of actually regrowing articular cartilage, that's not the actual goal of what happens with these procedures. Next question, will a stem cell procedure regrow knee meniscus? Any results from any major research outside of Regenexx done on stem cell PRP procedures? There are a lot of major research that's done outside of just Regenexx on all these different types of procedures. Stem cell procedures can help in certain instances to heal knee meniscus injuries. That depends on the type of injury and where that injury is actually located within the meniscus, because certain parts of the meniscus do not have good blood supply. But you're not going to regrow an entire knee meniscus with stem cell procedures. So the act of actually regrowing certain structures and regrowing cartilage and the sort of the science fiction idea of regrowing whole things from stem cells, that's not actually what happens with these procedures. But there are very focused areas that generate pain, that treating with this type of an approach can actually help with a lot of pain reduction, healing of inflammation, and actually generating very, very good functional outcomes for people, even in bone-on-bone arthritis. Bone-on-bone arthritis is what we treat for 95% of the patients that come into our clinic. So, when people come to us, they're already at the point where they have been told that they're not getting results from, injections and things like that. And the next step is going to be surgery. So, these are the people that we treat, day in and day out, with, again, very successful results. These are really good questions, guys. So I really appreciate you guys taking the time to put these out there. Does anybody else have any other questions or anything that that they want to talk about a little bit more? If not, I really appreciate you guys tuning in tonight. Hopefully I was able to present some good information for you and answer some of the questions that you had. Again, it would be great if some of you guys would come into the clinic and let us evaluate you and see what we can do. I think you'll be very happy with the results. I think I got one more question here. Yeah. How many patients at your clinic were hip arthritis? I mean, we see a lot of hip arthritis. There are a lot of patients that come in with end stage hip arthritis. So we see people all the time with arthritis in all sorts of different areas. So, like I said, we've been doing this for a long time. So the knee is probably the one we see the most. The spine is probably the second, shoulder third, and hip is probably in there too. But we see a lot of all of those different things. So we see a lot of every joint. So, people have arthritis, in all different places of their body. So it's not always just one thing that we're treating for people too. And again, I think a lot of the numbers, like the actual numbers of patients that we've seen or that we've done for treatments with these different areas. I know it's broken down by different areas on the website as well. So please go to the website, regenexpittsburgh.com, look at the information that's on the website, look at the data, look at the research. I think that would answer a lot of questions for you guys. I have next question. I have bone spurs in my hips as well as arthritis. Does it work there? Yes, it works for hips. It works for arthritic pain. Like I said, we treat arthritis and we treat pain in all different areas of the body. So, yes, we do treat hips. Next question. Do you see a correction of a bowed leg with knee stem cell PRP procedures? No. In most cases, we will not be correcting legs that are significantly bowed from joint degeneration. Now, again, we can do a lot to help with pain and to get a lot of relief. But as far as that deviation, whether it's inward or outward, we don't see corrections of the actual bowing in the leg. All right. Well, good questions. Like I said, I appreciate you guys asking. If you have any questions that are very specific to your own individual case, I would suggest giving us a call and setting up an appointment. I think it would be great for us to see you in the clinic and be able to do a better evaluation so we can answer, truly what we think we can do for these processes. I hope, like I said, that you guys got a lot of information out of the webinar tonight. I appreciate you guys tuning in. Give us a call, 412-963-6480. You're welcome. I appreciate you saying thanks for your time, and hopefully we'll talk to some of you guys soon. But have a good night and enjoy.